It is very nice to greet you again. In today's video we will talk about the following. Bloating in dogs. A potentially fatal emergency. Are you wondering why your dog's stomach is swollen? When a dog's stomach appears bloated, it can be alarming, and it is. Canine bloat is a potentially life-threatening condition that requires immediate veterinary attention. But what exactly is bloat, and how quickly does it progress? We've compiled a guide to help you understand better. What is bloat in dogs? Abdominal distension occurs when a dog's abdominal wall fills with gas, food, or fluid, causing it to expand. If left untreated, the stomach can twist, a condition called volvulus, cutting off blood flow and leading to death. Symptoms. The main symptoms include the following. A visibly swollen or distended stomach. However, distension isn't always visible in deep-chested dogs, so the absence of visible distension doesn't rule out bloat. Restlessness or pacing, unable to get comfortable. Retching or unproductive vomiting, i.e., trying to vomit but nothing comes out. Excessive drooling, rapid breathing or difficulty breathing. Weakness or collapse. Timeline of canine bloat. Bloat cases progress rapidly, often in just a few hours. I'll tell you what happens at each stage. 1. Onset of symptoms. The first symptoms may seem mild. Your dog might be uncomfortable or restless, with slight bloating. At this stage, the problem may still only be gas or food in the stomach that hasn't twisted, but time passes. 2. Expansion of the stomach. As the stomach continues to expand, pressure increases, affecting blood flow and putting pressure on other organs. This can cause pain, difficulty breathing, and restrict blood flow back to the heart. 3. Stomach torsion, blood twisting. If the stomach twists, it completely cuts off circulation, trapping gas and food inside. This is an extremely dangerous stage in which tissue begins to die due to lack of oxygen, and your dog may go into shock. 4. Internal damage. The longer vital organs remain under stress or without blood supply, the greater the likelihood of serious heart arrhythmias, or the need for surgical removal of damaged parts of the stomach or complete removal of the spleen. 5. Emergency response. Once you recognize the symptoms, you must take your dog to an emergency veterinarian immediately. The average survival rate for dogs undergoing bloat surgery is around 70 to 80%, and some studies show a higher success rate, up to 90%. This is why immediate veterinary intervention is so important, as the chance of survival decreases the longer you wait. 6. Recovery period. After surgery, your dog will need rest. The recovery period varies depending on the severity and timing of the procedure. Most dogs require intensive postoperative care, including monitoring and fluid therapy. 7. Long-term management. After surgery, long-term management may include dietary changes or adjustments to feeding routines. Risk factors. Understanding the causes of bloat can help reduce your dog's risk of developing it. The following factors are often associated with bloat. Breeds. Large, deep-chested breeds are more prone to bloat, including Great Danes, Saint Bernards, Weimaraners, Akitas, Basset Hounds, Newfoundlands, Irish Setters, Old English Sheepdogs, Great Pyrenees, German Shepherds, Rottweilers, Boxers, Standard Poodles, Doberman Pinschers. If your dog is a high-risk breed, consider consulting your veterinarian. However, abdominal distension can affect any dog. Every second counts in an emergency. When it comes to abdominal bloating in dogs, timing is everything. The sooner your pet receives veterinary attention, the greater their chances of survival. If your dog has abdominal bloating, or you suspect it, don't wait. Your dog's well-being is invaluable. Also, your dog shouldn't eat too quickly, as this causes gas, which can result in bloating. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.